So again, thank you everyone. As I mentioned, what we will be discussing today is the Predictive Order Management tab within Intergy EHR. We'll be covering a few things, actually more than just a few things. We will be covering, as I mentioned, the top panel view options. As I navigate over here into the patient's chart, you'll see that I'm already in orders and charges. So yes, we will be discussing the top panel view options and your ability to filter different views with those two top panels. In addition to that, we will also be discussing the patient panel when it comes to prescriptions, orders, and procedures, which is sort of that information you see in the middle as I drag this screen down. Give me just a second. I don't believe everyone was able to see my screen, and you all should be able to see it there, so I do apologize. Excellent. So as I was mentioning, Predictive Order Management, or the POM tab, or most of us who call it the POM tab, okay? We'll be learning this screen right here basically that you're looking at, which is really separated into three areas. Your first two top windows, or your two top panels, okay, allow you to view different types of information in those views. And I will go over what's the basic or the best practice recommendation in terms of what we should be looking at in there. One mainly. In the middle you'll see where it talks about within that patient panel, prescriptions, orders, and procedures. I'll discuss how to use that in terms of looking at the current patient versus all of the patients in your particular database, and then discuss the pharmacy link, how to update, or using the update problems button, as you can see at the bottom right there, the help button as well, and discuss the open orders report overview as well. Okay? So in terms of orders and charges, or the ability to use the computer for provider order entry, as you all know, the real purpose of computerized provider order entry, or most of you have already heard CPOE, is really to help decrease delays whenever you're working with orders, trying to reduce errors related to transcription. A lot of the things in the conventional world are handwritten when it comes to writing your prescriptions and things like that. Orders and charges is really a simple method in addition to all that stuff, such as posting charges. So this is an area that the providers really spend a lot of time, which is why we're talking POM, Predictive Order Management, today. Because what Predictive Order Management does really is it integrates the order entry portion of orders and charges into a more integrated or single location when making clinical decision support. For example, when you're in the Predictive Order Management tab, it makes the ordering a lot more efficient because you already have the drugs listed for your patient here. You already have the current orders listed for your patient here, as well as the procedures already listed for your patient here. So you'll see that when it comes to patient-centric care, doing a drug formulary check, becoming more efficient in the ordering process, you'll notice that once you master the Predictive Order Management screen, it makes the use of orders and charges a lot more easier. So we're really going to dissect the entire Predictive Order Management page before we actually begin to use some of the functionality. Okay? So first things first, if you notice, if you haven't already, I'm already inside of an encounter. Okay? This particular area of Intergy EHR does require an encounter. Most of the time, you're in here during a face-to-face office visit, and that allows entry into the orders and charges portion. Okay? Now, in my notes, you'll notice when I flip over to my note, okay, I already have active problems in here because that's the way the provider settings have been defaulted. So what I'm going to do is literally just click on the Cite button and show you how that information got there. And in the meantime, as I copy to the assessment these active problems that I have here, the reason why I'm doing this is so that you can see what happens in orders and charges as you're selecting or putting problems in your assessment. Many of you already know this and are aware that as soon as you put in a diagnosis in your assessment in the note, it automatically becomes part of what you all know today as a shopping cart, right down here at the bottom, okay? And it tells you right at the very end where these diagnoses came from the note, okay? Over here, you obviously have the diagnosis already part of this patient's problem list, which is the reason why this is right here, okay? So now that you've seen how this information gets applied to the shopping cart, again, those 3 diagnosis codes that you see at the bottom came right from the note. As soon as you diagnose or place something in the assessment, it transfers over into orders and charges. So what I want to start with before we actually get into some of the functionality is looking at these 2 first windows here at the top. Right now on the left, you'll notice that you have procedures already showing up from the note. In addition to that, you have on the right, it's showing orders for reminders that are due. So let me make sure I'm on the correct encounter. Yeah, I'm on today's encounter. So first, let's talk about the options that we have, and I'm going to use this side. You'll see that you'll have a drop down on this side to change this window with 1, 2, 3, 4, 5, 6, 7 different options. And you can do the same thing over here. I have 7 different options. They're actually the same options on each window, from active allergies to renewable prescriptions, and over here, from active allergies to renewable prescriptions. Okay? Typically, one of these windows, what is recommended is to have the procedure showing from your documentation. Therefore, if you're documenting anything that is tied to a service, meaning a procedure code, or a performance measure, such as a HEDIS measure, okay, that information, just like the assessment transfers over to your shopping cart here, anything in your note that is mapped or linked or tied to a procedure code, whether it be a CPT, a CPT2, a performance measure, it will show up here in this window. So you don't have to hunt around for it. Okay? Now, in addition to that, we're going to discuss what these other options are. Okay, yes, active allergies is definitely an option. I mean, if you were to switch this to active allergies and the patient had allergies, this panel will show you a list of the allergies and drug intolerances in terms of what is considered active in the allergies tab of the patient's chart. You could do the same thing with current medications. And as you can see, this patient that I have doesn't really have much to show us here. Let's just take a look at another patient here really quick, just to see if by chance Isabel Abdul has some information here, POM tab. And as you can see, she does have some information there. So we happen to be looking at patient current medications in this window right here. So yes, if you have this window looking at patient current medications, you're displaying the patient's current meds. As you can see, there's the drug name, the dosage, and the days left for the medication. So think about that. You don't have to navigate to the RX tab if you have this window set to the patient's current medications. The other option, as we go down this list, is orders for reminders that are due. So if the patient has a reminder that's due, basically the reminders are tied to the knowledge base for health management. So if there is any guideline that is tied or linked to an order, the system will remind you here of orders that are due in order to satisfy that particular reminder. So for example, the system here is reminding us that this patient needs an A1C. You can actually click on it here, and it'll prompt you to fill out the order details just like it does when you're using the Labs tab. So again, what it's doing is it's integrating that functionality into the predictive order management area, so it minimizes the hopping around, right? How about orders from the last visit? So if there were any orders that were placed in the last visit, it'll show a list of the orders from that most recent encounter. Okay, that's something that's not used often, but it's actually there and it works pretty well. It's not going to show anything that's on the current encounter. Again, the most recent encounter when the orders were assigned. Patient information. So very similar to the info tab that's right over here. It's actually in light blue. You're pretty much looking at the same information here. Okay? I personally wouldn't recommend that one because of, you know, the need to actually scroll when you could actually glance over here on the left side, where you can clearly see the pharmacy, the insurance, right? All of the appointment information. It's already there for you on the left side, right here. The next one, as you can see, we already have on the left side. So if I was to choose this one, we would be looking at the same thing on in both windows. Okay? Procedures from encounter notes simply means that this panel is going to display a selection of charges or a selection of procedures that's been generated from the note, from your documentation. Specifically things such as your E&M code and other charges that may be linked to things that you're actually selecting in orders and charges, okay? Renewable prescriptions. We kind of talked about that one already because that was the one that was already there. And again, that displays any prescriptions that are available for renewal. So again, it's integrating. If I show you this list one more time, it's taking each one of these sections. So in terms of orders and charges, things such as current meds, orders for reminders that are due, orders from the last visit, procedures from the encounter note, renewable prescriptions. About 80% of the things that you typically do inside of orders and charges can be done right from the Predictive Order Management tab. Okay? And I'm going to show you over here on the left in just a moment how you can use the procedures from the encounter note to drop here into your orders and charges cart. Okay? What I'm going to do now is just flip back to Brian Abner. And the reason why is because these windows that I have here in the middle are blank. And they're blank for a reason. Okay? They're blank because Brian Abner does not have, okay, any current medications related to that diagnosis that I have highlighted here. If I was to highlight this diagnosis here, you'll notice that he does not have any particular medication, order, or procedure for that particular diagnosis. So what I'm basically saying is if you select a diagnosis, whether it's from the patient's problem list here on the left, which happens to be the same ones here that I have on my shopping cart, okay, and nothing is showing up, that basically means that there's no orders for this patient for that particular diagnosis. As you know, the drug panel basically is going to contain medications previously ordered for that patient, and there aren't any, okay? In the middle, the orders basically, or the orders panel contains things such as lab information, previous orders that were entered for the patient. So you will see things in there such as referrals. So you can easily access not only labs, but referrals, procedures. Everything that you see here on the top of this screen, if I go down the list, cardiac, follow-up, in-house labs, injections, anything that's been ordered on that particular diagnosis will be showing up in that orders tab. Same thing with the procedure panel here on the right. The procedure panel contains charges previously posted for that patient. So if I go back to Isabel, you'll notice she has more activity. Okay? She has much more activity going on here. And if I was to highlight a diagnosis, if you do not see anything in the drug or the order or procedure panel, there's no activity historically for this particular diagnosis on this patient. So if you're wondering why a lot of times you don't see anything, is because there is no activity in terms of previously posted or previously entered or previously ordered information on that particular diagnosis. Okay. Now, when I highlight this one down here, okay, which is obviously an assessment that's being pulled in from the note, okay, there is some activity related to preventive medicine new patient evaluation. As you can see, when you click on that, now I see information in each one of these panels. Drug-related information, order-related information, and procedure-related information. So there is some history we can pull from if indeed I needed to prescribe one of these medications or order one of these procedures or labs or referrals for this patient. Or over here on the right, use this to drop my evaluation and management code. Okay? Now, there is another feature where you could actually use all patients to select and display information in these three windows. And what does that mean? That means rather than look at the current patient, how could I compare what is done with a particular diagnosis for all patients in my database? Okay? So for example, if I was a physician and I wanted to look, or maybe not look, the right word is compare, and I wanted to compare how the hypertension diagnosis code I-10, okay, can be treated, I could look at all patients in the directory or all patients in the database, and then if you notice right over here where it says orders for all providers, since I'm not logged in as a provider, it's not defaulting to who the provider is that's logged into the system. So if you're a physician and you log in and the system recognizes you as a provider, you will be defaulted here. And this could be changed to select all of the, one of the providers in the practice that you may want to compare CPOE, computerized provider order entry, for that provider, or you can just look at all the providers and say, okay, for hypertension, here are the recommended drugs in order of frequency. Here are the recommended orders, again, ordered by frequency. And last but not least, here are all the typical associated services, including the E&M code. And you'll notice that you will see some performance measures here and other things related to test codes that can be used to associate with your diagnosis here. So the idea here is using or utilizing the system's level of intelligence, also known as decision support, to help you make decisions on what drug should I prescribe, or perhaps a way of verifying if this is the type of drug that I should be prescribing for this diagnosis. And the same thing goes for your order. You may already have an idea, because you already know what you're going to order for this diagnosis, but rather than go to the labs tab, which pulls me away from everything else that I can do in this one integrated area, I can click on these items and order a lab. Click on these items here and drop a procedure code. Or back to the drugs, I can click on this medication here and order it. So again, the idea here is just taking a diagnosis that you have here in your shopping cart and listing everything based on that selected diagnosis when it comes to medications, orders, and procedures. If I highlight this diagnosis and nothing pops up, or in this case, you'll notice that there's no information on any types of orders for this diagnosis, J02.0, right? Streptococcal sore throat. I don't see any procedures either. However, I do see here that there's a medication that's being listed associated with this diagnosis, allowing me to write a prescription for amoxicillin, as well as this medication here. If I highlight this one here, again, you'll notice based on the diagnosis, the system is making a decision based on the data that's sitting in there to tell you, okay, for type 2 diabetes, okay, with hyperlipidemia, here are 2 recommended medications. And again, remember, the order is going based off of how often is this medication prescribed. Well, metformin is prescribed 20% of the time, which is why it's at the top. Over here in the middle, as you can see, 27% of the time, a lipid panel is ordered for this diagnosis. Okay? I can change the sort order if I want. If I want to look at the last day that it was used, or I can just switch it back to the frequency. I can do the same thing over here for the procedures. What was the last procedure used? Okay? It was the 81002 for a UA dip. That may be what you need to capture. And if it is, you can click on it and notice how it drops it to the bottom in your shopping cart. That's the whole idea, is to be able to be in an area where now I'm being more efficient in terms of capturing not just my charges, but a referral that I may need to order, or a lab that I may need to order, or a medication without having to find it. It probably is going to be in this list here because it's been prescribed so many times for that diagnosis, it will show up here. Just changing this frequency back to the way it was defaulted. So if I was to click here, okay, the same thing will happen whenever you order a script. If you have favorites set up, okay, it'll recommend to you, what dosage do you want to select, and you basically fill out this screen. I meant to hit cancel because I just want to skip to the next one here, and I'll come back to that. But over here, let's say I was ordering a lipid panel. If I click here, notice how it does the same thing that it does when you order a lab. Now, for those of you who are aware of some of the default settings that you have access to in your general preferences, this lab order details may or may not pop up. In my case, it's popped up because I don't have my default settings set up so that it knows who to task this to. So for now, I'm just going to mark this as ordered. Okay, so you can see that it drops down just like it would if you were on the Lab Favorites tab. So if I wanted to order another lab, let's say the CBC, okay, because my settings are not defaulted, I need to specify what am I doing with this order. Am I tasking it to someone to complete the lab order, or am I just going to mark it as ordered, which is what I'm doing now. The same thing for the referral, let's say to the cardiologist, I can do the same thing. So if you think about it, these 2 lab orders would have normally came from the labs tab. This order to the cardiologist, or this referral to the cardiologist, most likely would have come from, right, the referrals tab, most likely. Okay? Now your charges, if I have not completed my documentation, it's the same thing today. If you're ready to drop your E&M code for this office visit, today you probably go straight into charges, right? And you probably go to your favorite and you drop your charge. Well, in the POM tab, you have access to the same thing. The only difference is this is pulling from historical data, because I can grab my 99213 right here. Right? If I click there, you'll notice that it drops the charge right there. I could take that a step further. In charges, as you know, if you have multiple diagnosis codes in your shopping cart, in this case we do, we've got 3 diagnosis codes there. So the system will allow me to assign multiple diagnosis codes using this shortcut feature here. Okay, if you weren't aware, or for those of you that have been wondering, how could I use the multiple diagnosis feature from the predictive order management tab, you can actually do the same thing. I'm highlighting my primary diagnosis, and I'm coming over here, and rather than doing a regular click, I'm right-clicking. And when you right-click, guess what? You're allowed to use the same feature as you would assigning multiple diagnosis codes from the Charges tab. So here we go. I can click my second and my third, and the system does the same exact thing as it would if you were using the Charges tab. Okay, I'm going to remove this for just a moment because I'm going to come back to that. Whoops, I think I hit. So now we have this window right here is blank. So what I wanted to show you is when you're using procedures from the encounter note, exactly what that means. Okay, so for that I'm going to go back to the note. And the reason why I'm going back to the note is so that I can go into forms, right? And what I'm going to do really is just click on a few things. I'm going to go to the quality measures form. And as you're documenting, okay, for those of you familiar with this form, if you'll notice, there's a lot of information in these forms, including some procedure codes you've definitely noticed before if you've used this form. I'm just actually pointing them out to you here as the screen transitions, okay? So the forms are designed so that when you're clicking on items such as what I'm doing right now, as you can see, okay? When you're clicking on items that are associated with a procedure code, okay, so let's say this patient is coming for an annual. This is a 47-year-old, so I'm just going to come over here and click this. Anything that you click on in the forms that is mapped or linked or tied to a procedure code, just like an assessment, right? If I was to go back to that diabetes tab, right, and go to assessment, and I click on something from here, these items here are also tied to diagnosis codes, right? So if I was to click here, okay, and just save this for a moment so we can look at our note. So the only things that are in my note are things that I've clicked on this far, okay? I'm going to go ahead and add in my allergies, my current medications, some social history, medical history. Let's go ahead and add the family history, just enough to populate some more information on this note. And it doesn't look like much happened there, okay? But notice how your E&M code, if you haven't done this before, your E&M code has a calculator telling you, okay, what you've documented so far. It's only a recommended code in terms of the information that's sitting in your note. But I'm not going to accept this at the moment. And the reason why I'm not going to accept it at the moment, if you recall, when I was in the quality measures form, I had already specified this is actually going to be an annual visit. Okay, so I already clicked on this box right here. So let's save it for now, and I'm going to go back to orders and charges because now I'm ready to, write my prescription and order my labs and my procedure, which we've already done some of that down here at the bottom. However, if you look at this screen, Now you have information that has already pre-populated the encounter note, the procedures from the encounter note. This was empty. This information is strictly being populated from what I clicked on here in the note. Okay? So all this information that you see here down here at the bottom, including the preventive medicine new patient evaluation visit, automatically populated this window right here. Okay? So this information is ready for you to simply drop it into your shopping cart. So if you were to highlight a diagnosis and hit select all, yes, it will drop everything into your shopping cart that's associated with that diagnosis that you had highlighted. But as you can see, the cool feature with predictive order management is that you're already in a spot where I can not only drop charges, now I'm ready to write my prescription, right? There it is. Now I'm ready to order my referral for the mammogram. This one prompted me to answer some questions, so I'm just going to go ahead and answer these. Okay. Now, if there's any other charges that perhaps may need to be dropped at this time, you may be able to find them here under the Procedures tab or the Procedures window. Okay, but pretty much you've already associated everything that's been done in the note at the bottom here in your shopping cart, right? So this save button, as you all know, that's like the point of no return, if you will. Once you click save, what that means is that everything that you've worked and everything that you've accumulated, everything that you dropped into the bottom section of this tab, whether you're in the Charges tab or the Labs tab or the POM tab, when you save, it literally saves this information you have here at the bottom, and you cannot make any modifications to that. So if you have any orders that need to be modified, they need to be edited from the chart. If you have any related charges and you've already hit save, that means that they are already in the practice management system waiting to be reviewed and posted. If that's the case, then those changes can only be deleted or voided from the practice management system. Okay? Yes, what you should be doing is dropping the correct code and advising whoever is responsible for maintaining and posting those charges to delete what's incorrect. There's really no other way to send a message unless you're going to send a task, but depending on your workflow, they may not be able to view that task right there. So and just keep in mind, anything that's in your shopping cart that is saved has been sent, has been tasked, is sitting in pending charges. There's no way to correct that, especially when we're talking about anything with a $sign next to it. There is no way to correct those items that you've saved unless you notify someone, typically at the front desk or your checkout or your internal billing department. So they're aware of things that need to be fixed. In terms of the pharmacy, as you can see here, there's like a little link here where it says no pharmacy. The no pharmacy means the last prescription that was written did not go to a pharmacy. In parentheses, it's going to tell you how the transaction was processed. In this case, it was printed. So because it was printed is the reason why most likely there is no pharmacy there. But the reason why it's a link is I can quickly change this, right, and select the pharmacy. So if you have some favorites set up, they'll pop up really easy that way. Okay? And what this does is it sets the pharmacy so that now every time you write a prescription, it's going to use that. That doesn't modify the default. Remember, the default is always going to be what's set here, okay, inside of the patient's chart or in the patient's account if you're setting it from the registration level in PI, in patient information. If I click back on pharmacy, you'll notice that there is a default. I did not check on it the first time, okay? Now, if you use that button to set it as the default, not only can you write your prescriptions now and have it default to Madison West Pharmacy, guess what? You've already done two things. You've set it so that you can write your prescriptions and use that pharmacy, and you've already set the default, okay? The reason why they have this check mark, as you can see, that check mark is not there, but I can come here and I can remove this. The reason why is because there's a lot of times when a patient may not be in the area, or for whatever reason they want just to go to this pharmacy today. They don't want you to change the default. So by doing it this way, allows me to write prescriptions just for this pharmacy without touching the defaults, without modifying what's already been set in the system as the patient's current pharmacy defaults. Okay, so if I was to hit save, I have a warning here. Problems performing the DOR will not be displayed and patient education will not be printed. The reason why I'm getting that pop-up is because there is no updated DOR in the training environment. You will get a warning. I'm not saying that you're not going to get a warning, but the system will run its safety checks against that prescription before you actually hit save. So as you can see, everything grays out. Okay. The reason why these are popping up is because I wrote a couple of referrals, so the system was prompting me to say, do you want to print out the referral order for this? I could have said yes, and the system would have printed out correspondence associated with that referral order. But here, as you can see, everything's been grayed out already. I know this may seem fundamental to a lot of you already because you're used to this already. Here's that point of no return. Here's that area where now, if any of this information is incorrect or needs to be changed, it can't be changed from the EHR. You must notify someone in the clinic, typically, like I mentioned earlier, someone at checkout, someone at the front desk, or perhaps someone in billing who monitors those charges so that they know what needs to be corrected or deleted. Now, what I haven't talked about in terms of predictive order management is a lot of work that goes into selecting the diagnosis, perhaps even rearranging the diagnosis code. I'm not sure if you all are actually doing that today. That's not really meant for this, but I am going to touch on it in just a moment. I just want to make sure that in terms of predictive order management, I just want to take a step back just to make sure we all understand when I use the term integration or the ability to take certain tabs and orders and charges and stay on one screen, I'm referring to when I talk about integration when it comes to writing medications. If you go to the RX tab, okay, all you see here are medications. So I can only work with one thing as I'm in this tab. In predictive order management, you have not only your prescriptions, you have everything else, and vice versa. If I was to go to the labs tab here, yes, I do have a complete list of lab tests that I can order from here. Chances are, though, if you're already documenting your assessment from the note, you're already going to have a diagnosis down here. All you need to do is highlight it, and the system is going to basically give you a list of labs for that particular diagnosis. If I move this one over, you'll see the frequency here. And it's going to list it I don't know why I'm not seeing the frequency here. Okay. Probably because I'm not looking at all patients. That's why. That's why. Notice how I didn't see the frequency before? Because I was not looking at all patients. When you're looking at the current patient, the system is saying, okay, I'm showing you all the medications, the orders, and the procedures that this patient has for this particular diagnosis. When I look at all patients, let's say for a particular diagnosis, now since you're looking at every single patient in your database, it's now able to say, okay, for all these patients, 33% of the time a lipid panel is ordered for diabetes. So if I click on this, I can order it. Now you're probably saying, okay, why would I order something, right, if the diagnosis didn't come from my note? And I absolutely agree with you. You'll notice that I can grab a diagnosis from the patient's problem list over here, and the system will allow me to click on an order and use that diagnosis to process an order. Absolutely. Okay? So yes, I could send a task to order an A1C for hypertension, and this diagnosis right here is not even in my note. For example, if I go to my note, okay, well, that's not a good example, but we have actually, yeah, I-10. If I go to my note, if I go to my assessment, I'm sorry, I got confused with my active problems thinking I was looking at my assessment. But if you look at the assessment, you don't see a diagnosis for hypertension. Again, orders and charges. Okay, there's a diagnosis for hypertension. Now, if I order this lab, I'm going to go ahead and hit save. If I order that lab and I go back to my note, you're not going to have an assessment there. That's not what I'm saying. But if you scroll down in your plan, it will show you the diagnosis associated with that lab order. Ideally, when you're working with your encounter note, ideally the best thing to do is to have your assessment already documented. That way, you're already leveraging the predictive order management tab to use that diagnosis to make decisions for you. Again, another reason why it's important to always have your assessment done ahead of time. Okay, let's talk a little bit about updating problems and using the Help tab. Now, this Help tab right here is very similar to orders for reminders that are due. And as you can see, there's some orders here that are showing up as due. Many times, and I know you all have probably seen this as well, many times there are no orders linked to the reminders that are due. That's just basically the way the system has been designed in terms of some of the reminders that really are driven by orders in terms of how they're satisfied. So understand that not everything is linked to an order, though there may be some things. But the Help button is really here. I'm going to go over the Help button before we actually discuss updating problems. But the Help button, if I was to go in there, really what this is for is to do two things: satisfy reminders manually, as well as order things for reminders that are due. Okay, so if I move this screen just a little bit here, as you can see, we have A1C, urine protein, pap smear, chlamydia infection screening. That's what you're seeing here in that little window in the back. The A1C, right? The chlamydia. So the reminders that are due for this patient have associated orders linked to them so that I can order it and satisfy the reminder. So if I click here, yes, the system is going to order it just like it would, just like I would be ordering it if I was clicking on the A1C from the lab's favorite. If I close this and click on it here, as you can see, it's literally doing the same thing. Okay? Now the other option from this screen is the bottom here, and if you've been through any of our webinars or educational sessions or maybe training, you already know that satisfying reminders manually is not a recommendation. That is not a recommendation that should be followed unless it's something to temporarily exclude or for whatever reason the patient has refused something, although that doesn't mean the patient is still not required to have something satisfied. We do not modify anything manually. This, by the way, is the same thing as going into reminders, just like I'm doing here, and saying that this is being satisfied today, okay? You actually are supposed to be leveraging the forms that are designed to satisfy the reminder automatically, okay? So just in case you wondered what the health tab was for, it's basically that, to order for reminders that are due as well as satisfy reminders, okay? Updating problems. Now, there is an advantage to updating problems from here, okay, even though I could right-click. As you know, I could right-click and I can copy anything in my shopping cart to the problems list. If you notice that copy the problem is grayed out like it is here, that means that it's already sitting in the patient's problem list, okay? However, by clicking on Update Problems, as you can see, the system is already loading up problems that have yet to be added to the patient's problem list, okay, or new problems that the system is recognizing today, okay? So if these are new problems that need to be added, then what you do is you click, and then when you hit save, those problems now become part of the patient's problem list, okay? This feature is not a new feature. This has existed for quite some time. More recently, this Intergy Greenway added the ability to copy problems from the note, as you can see right here, in addition to, as I just showed you, the ability to right-click here and copy the problem from orders and charges. Now, what I would recommend, because I know we are all struggling with updating clinical history, is I'm just going to collapse the first few items here so you can see that in this window, you have the ability of updating the patient's clinical history. So if I move this to the side here, and I click on clinical history here, actually I cannot do that, it's an active window, but let me open that up and go back to my active problems, okay? You'll see here that the patient's medical history, or I should say clinical history, is exactly what you see here on the left side in the skinny list, or in the chart list right here. So you have a couple of options. Okay, if you like to work inside of predictive order management or the charges tab and you want to update problems, you can use this button here, and I could deactivate this by hitting inactive and hitting save, right? So I'm updating this one here, right? Tobacco use over on the left. Okay, you can use that to update clinical history. Okay, so again, I can just easily scroll down rather than click on those plus signs. But the idea here is you have an alternative. You don't only have that one option to modify or update clinical history from the chart. I can work with this window here and click on the active button, and I can inactivate. As you can see, I can just continue to work. And it's a little easier working from this screen versus over here where you have to come out and do it from here. It's up to you. It's really up to you. But the idea here is that from predictive order management, again, another integrated feature where I can update problems from here as well. Okay. The DUR button, by the way, is the same thing as the DUR button here. So I'm clicking on it here on the left side to show you how it'll force the DUR to run, because you may have added a new allergy for this patient, or the patient now has additional reported medications, and you just want to run the DUR just to make sure there are no critical warnings now that you've not only updated the allergy list, but you updated the medications list, and now what you want to do is you want to run the DUR. So yes, you can run the drug utilization review or drug utilization report from orders and charges, as well as here on the medications list. Okay? All right. Now, in terms of managing open orders, there is a report that can actually be reviewed from time to time. I know this is something that's not necessarily performed by any of the physicians, or there may be some physicians that kind of do play a dual role, and they act in terms of supervising physicians in terms of open orders, unsealed notes, unreviewed labs, and things like that. There's a couple of ways that you could actually manage the open orders report. And I'm going to show you two ways and then come back to the predictive order management, and I'll unmute everyone so we can answer some questions. But from my day, as you know, there is an orders button that can be used, okay, to get a better idea of the number of open orders that are out there. This is more from a viewable and workable view, for example, where you could actually plug in your name. So if there's a policy in place where you need to come in here and you need to review all orders that have been resulted, okay, then you can do that. Because if there's any orders out there that have been resulted, I can quickly come here, glance at this, click on these items, right? I can either double click or I can use the bottom page to work with it, and I can close the order. Okay? Anything pending or in the requested status is probably where you're going to notice most of the work has to be done. And the reason why I say that is because a lot of items that are pending, or what Intergy refers to as requested, means that the order was requested, but it hasn't moved to that next step where it's been ordered by the lab or ordered by the referrals department. So it stays in a pending or requested status, and if not, if you don't reconcile, or if you don't make sure that when that result comes back that the order is linked to it, then you're going to have open orders out there for quite some time. So this again is just a matter of coming here and looking at what you have in requested status, and if you see that there's a lot, then you might want to run a report to see how much you actually have out there, which is what I'm going to show you in just a moment. If you take a look at resulted, and you see stuff that's already been resulted, again, if it's been resulted and you've reviewed it, these orders should be closed. Okay? Again, I can just double click on it, mark it as closed, and hit save. Ordered means that it was actually ordered. So in the case of a referral, for example, if you ordered a mammogram and you requested that referral to be processed, and that person that you tasked it to actually processed the order and they marked it as ordered, again, that order, it will stay out there until someone reviews it. And typically, the prompt is when the result gets tasked to the provider. So if it's a lab, providers are getting lab result tasks. If it's a mammogram report, the image should be scanned and tasked to the provider. That is the prompt. That is the prompt to associate the order with that result before it's closed. Yes, there is a new feature where whoever is responsible for scanning that document can 100% guaranteed link that result to the order ahead of the task to the provider. So the provider really is only responsible for reviewing the report and closing the order, and the associated order will close automatically. I think I said that wrong. When they get the result, they're looking at the report, and all they need to do is hit review or complete, and the order associated with that result will be closed as well. Okay? So just keep in mind, resulted, if it's been resulted, it's a good opportunity to look at the order, and if you can close it, by all means, go right ahead. Requested is pending. Ordered means you haven't got the result back, or if you did, the order was never resulted. At that particular time, you can make sure that the result's in the system or the chart, and then you can get rid of that. Now, yes, you can run a report. Rather than look at this screen, you could actually go to this reports section from the Intergy EHR drop-down menu, reports, and go right into Open Orders Report. Here, if you notice, you're looking at the same filters as the window in the background. My ordering provider, right? My order type, my order status, who I sent it to, the priority. So I can do the same thing, right? Forward, and I only want to look at, let's say, labs. Let's just look at labs. All labs that are in the that I've ordered that are still in the requested status. Okay? Hopefully this won't take too long to run. But the idea here is if you notice that you do have a lot and you rather work with a printed out list, this is something that that you could do. And there it is. So if I open this one up, okay, as you can see, I only have 2 pages. It tells me right here 1 of 2 pages. But this will give you a better idea in terms of what you have out there. And notice I only ran it for the requested status. You may have things out there that are beyond 6 months old. So depending on when you're supposed to go back into the system and close those orders, whether it's 3 months or 6 months or whatever that time frame may be, you can run this report to at least know who to look into to go in the system and close those orders. The challenge that I'm sure most of you have is the patient comes back, a new order is issued for that patient, and now you have an order in the system that's 6 months old and a new one that was just ordered today. So at some point, you have to reconcile those orders just to really stay on top of things. Again, I kind of deviated away from some of the predictive order management things that we were talking about earlier, but I just wanted to take that opportunity to show you how you can run your open orders report either in the system by using the order tab here and getting a view. And if you don't like the work pane, I can uncheck this and kind of get a better idea of what I have all together. Or if you like working with the work pane, as you scroll down each one of these, that is simply up to you. Again, to run the report, Intergy EHR drop-down, reports, open orders. All right. So in terms of predictive order management, again, the idea here is that you now have a single location to make clinical decisions. The system is making the decisions for you, but the idea here is that you have one area where now I can use this window to drop all my procedures that are coming from my documentation. Over here on the right, what I would recommend is choosing what might be the best option that you see fit. For example, renewable prescriptions might be the best idea. Typically, that's one of the first things you do is you write a prescription. Well, guess what? Here are all the patient's medications, okay, that are renewable right now. Okay? If you want to write a new script, most likely, if you were to go to all patients, you're going to find the drug or the medication that you want to write depending on the diagnosis. Okay? In addition to that, I have a window now where I can grab a list of orders because, again, keep in mind, predictive order management is making clinical decision support for you based on the diagnosis. And I could look at either the patient's current patient, or compare the treatment plan, if you will, by looking at all patients for all providers. Remember, this window here is going to be defaulted to the provider who's logged in. All I would need to do is switch to all providers, and now I can do my comparison against the entire database. Okay? I'm going to go ahead and unmute the line. Give me just 1 second. Everyone's been unmuted, and it looks like we did get a few others that have joined. I mean, we only reached about 17, and I think some may have dropped off already, but let me see here. I knew this wasn't going to take too long. It's 4:09. For those of you that are still on, are there any questions with what you've seen?
No.
Okay. Okay, I don't want to call out anyone. But if there are no questions, what I would like to do, yes, I do have a question. Do you have any handouts to go along with this training? Absolutely. So not only will I follow up with everyone in terms of what we talked about here, I definitely do have some documentation for predictive order management that I'll include to all the attendees that joined this session. So yes, thank you for that. Are there any other questions? Because what I'm going to do, if there are none, I'm going to launch a poll, and what I'm really hoping for is to get your feedback as we put together monthly standing trainings. We're hoping that these are helping to, facilitate some of the stuff that's been requested either from support or from meetings that we have during our standing trainings monthly here at the network. But yeah, please feel free to provide me with your quick survey, and I would really appreciate that. So if there are no other questions, thank you everyone for joining, and I hope you have a nice rest of your day.
Brian.
Thank you.